Coffee. Ready. Good evening, everyone. This is our weekly well-being tips. You are here with Mrs.P. And I am going to tell you, we're sharing something, section 1, which it will be in the book because the book launches in November. But we're going to have a 2-week opening spot for healthcare advisors, professionals, share what you have that's of value you can utilize and give to others to be able to do better and know better in their lives. Ruff. She always laughs because when I say it, it's because she is not a joke when it comes to getting your body right and something going on with your neck or back. Dr. Ruff graduated from the kinesiology program. I think I'm saying that right, kinesiology. And that she graduated cum laude. So, that means she went above and beyond after her B.S. She went on, she's a bigger, better thing at Baylor University and graduated with her doctorate degree in physical therapy from 2019 2021, then get licensed and dry needling. She's amazing with clients and patients. It's phenomenal. So without further ado, I'm going to bring Dr. Ruff into this room with us so you can hear and feel the knowledge that she has and empowered to utilize what she shares. When I ask questions, there are some tough questions, but she's going to share with you from her knowledge base and her training from real world, right? As well as that heart center where she comes at you in her establishment. Her colleagues as well over there at Athletico. Let's get into the room and see how you are. Hearing and Dr. Hello. Happy to be here. Excited. Yes, and I'm excited to have you here because like I was just telling our friends and family here in this room that at the end of the day, you are that person that pours into a person, even when they don't know what you're about to share is the real deal for you. And I mean, if you don't mind me sharing, I'm going to share something that I know I've heard you say directly to me. Sure. I went to her because I had been sent somewhere else and told one thing about my shoulder. Immediately, she did her own thorough advance. You know how you look at stuff. And of course, she did as well. She read the report she was given. But she let me check something else. When she did, she's like, well, I don't think it's probably that frozen shoulder. I think it's more than that. Something's going on with your neck too. I'm not dismissing your shoulder. It's more than that. There's some cervical issues. We need to get that looked at. But let's start here. We'll start low at the bottom, and then we'll tweak up to give you more range of motion. I could barely raise my arm. This whole left side was puffy and red. So sensitive, even if you blew on it or barely touched me, I was in severe pain. Sure, what she has been doing with me for weeks now. I can do it. She's a chance to tell you that wasn't possible for me. But to tell you how I know that she know her information, because remember I told you she did graduate from UT, and then she went on to Baylor to get her doctorate cum laude. She knew something. I only gave her the results of the MRI. Well, I only just got it done.
Probably 2 weeks ago. 2, right?
Yeah.
You did all the work. I just told you what to do.
She doesn't just tell you. See, the way that the old Army veteran brain works, she got to show me. See, she being modest when she says she just told me, no. She's all great. That adjusts what I'm doing. But it needs to say what she does show you and tell you does work because I can do this with my arm. But the MRI did show that there was cervical damage. There's compressed and bulging. And I'm like, what? She hadn't seen answer in my body, but she knows her stuff. She knew what was right. And so I'm glad to know that there are folks still in the healthcare industry. She does dry noodling as well. And I've seen that where she's helping people be able to just move around when that's something you would think that you could get easily, openly, and readily available for you as a team. It's phenomenal. Thank everyone for being here, listening to Dr. Ruff, because what you're about to hear is knowledge you didn't realize was coming into you. Wow, 8 questions. We're going to talk to this doctor at the end of the day. She ain't no joke. The thing is, she a little bit more, just like me. Which I love a power that's law packages. Dr. Ruff, my first question is, how can physical therapy be better integrated into preventive care rather than just post-injury and post-surgery.
Research tells us that participating in PT prevents overutilization of imaging. It prevents or decreases the use of opioid medication and helps prevent surgery. We see improved outcomes post-operatively with participation in prehab with surgeries like joint replacements, ACL reconstructions, and rotator cuff repairs. Beyond orthopedic injuries, PT can help prevent falls in our older population and decrease pain. In the state of Texas, the state in which I practice in, I'm able to treat most patients for 10 days with referral, 10 business days, a direct access period with most. So I think the best place to start integrating PT into preventative care is with the provider, like our primary care and orthopedic physicians, creating a model where PT is utilized at the front of care rather than at the end, so we can prevent more invasive actions. So something like trying PT first, and if that conservative management failed, then looking into things like injections and surgeries.
Like getting in front of it. Because you started helping me before we got the MRI. I have range of motion I didn't have before. And I can carry a laundry basket when that wasn't possible. I was asking my husband to move it. And I, as an older veteran, I like my independence. To get that back, I'm in gratitude for. Thank you for that. You're absolutely right. Just getting in front of what's going on with your patients. It's going to be the world of difference. Especially when you're talking about opioids, because that's a humongous thing going on in this country, and definitely in Texas. So people aren't wanting, and the pill isn't the first thing you go do, because that is something I talk about all the time. Like when it relates to mental health, I've been where some of you are, where my docs initially thought all they needed to do was pad medication. How about if we learn something we did to get to that winning situation where it's better for me and I can begin to take back control of health? Let me ask you, when you say get in front, what do you see? I don't know if you've seen this with a lot of rheumatologists, they'll tell you that with fibromyalgia, even though it's a nerve pain, it spreads throughout the body. Depression and anxiety can lead to it because the person is so much pain, mentally, it starts to affect them and emotional.
You can't take mental health and physical health and make them independent of each other. We're one being. I think that plays a big role. You can't just treat that with exercises, right? There's a mental component too that needs to be addressed, not medications.
Sure. I mean, like I said, I wanted to piggyback with she's talking my language. This is exactly what I talk about all the time. Like, just try what I'm saying. It may sound crazy when you first hear it, but give it a shot. And you see how they connect the dots. They're not missing. Question 2, how can physical therapy help combat the growing issue of burnout amongst your own population, like amongst PT healthcare?
Yeah, burnout's huge. It's everywhere. And for me, it starts with the environment of the company and the clinic that you work at. So a company that values time off and has processes that streamline administrative tasks like documentation is definitely a difference maker. I think what's overlooked when it comes to burnout prevention is student physical therapists. In PT school, we do clinical rotations. It could be 7 weeks, it could be 6 months, just depends. As that co-instructor, if we spend a long time instilling good habits and boundaries into the student, we can help prevent burnout for those future PTs.
You can't say, do as I say, not as I do. We mimic right. You are the average of the 5 people you are around. Spouses begin to finish each other's sentences, and the marriage ones are judged. Why? Because you are around them so much. That would be great if you can instill in that way. Healthcare should be the same as how alignment is. You'll hear people say work-life balance all the time. I've worked with the brand effect. If you do work-life balance, you're talking about the outside, determining what you do. If you want to really be in alignment, it has to come from within. It has to be you. So it's more of a work-life balance that controls your balance on the outside. But you must start here. If it's ingrained in you, or instilled in you, you will know those proper boundaries. You will know the things you're supposed to do that are best for you while you're still excelling. And I know for me, if I would have had any insight that I know now, I wouldn't have had congestive heart failure. Like these things wouldn't have worsened until my heart got so weak that I almost died. Those things wouldn't have occurred because I would have had things in place that didn't allow that damage. I'm grateful that you're talking about it because it is something I think we as healthcare professionals need to be pushing. Question 3, how do you see the relationship between mental health and physical therapy evolving, especially in treating chronic pain or long-term rehabilitation? We touched on it when we were talking about fibromyalgia because it is a long-term condition, but
Chronic pain's hard. In treating chronic pain for physical therapists, our biggest tool is what we call pain neuroscience education. PTs are movement system specialists. We're not mental health providers, but it day that mental health doesn't play a role in physical health, right? So pain neuroscience education, or P&E, is what PTs use to help explain the nervous system's role in chronic pain. I always recommend my patients see a licensed mental health provider. A lot of my patients do. I get a pushback, especially from my older population. But I do think that is improving over time, and it'll continue to improve. Whenever we see a patient and say they're at a certain point in their care where they're ready to get a knee replacement, we always have someone in mind where we're like, go to so-and-so, they're great, see them for that surgery, they have great outcomes. We realize that we don't have a mental health provider like that. If we refer to primary care physicians like, he's great, she's great, go with them, and say orthopedic doctors, why don't we spend just as much time building relationships with mental health providers that we're referring to them in the same way? If I'm saying that physical and mental health are just as important, why not build those relationships?
I knew it because even when I'm just asking you something in passing, you drop a nugget. It's like, what would you work it up? Or you give me a sticky with it on there. Being an Army vet, I've been in Houston where I underwent physical therapy. I have never been anywhere like electrical, but everything about everyone there. Initially, my focus was just you because now you're the person who, for one, is going to make me understand that pain is necessary, but if you do this right, we're going to strengthen this. So I could feel and see what the improvement looked like to know what the bigger picture was on the other side. When I'm talking to you, I'll ask a question. You'll give another valuable nugget. Then say, let me ask so-and-so. I don't know if I'm allowed to say her name because she's not on the podcast. But yeah, is valuable. She will turn to you with a right. Remember when, and then she'll sprout off like a whole nother list of details. I mean, you guys go back and forth, figuring something out for me and write it down. You don't just say it in passing because you don't think it's important. You make sure I leave with it. If a medical have hired PTs like you guys, like Dr. Ruff, I'll ask for later, that even the doctors and training with you just to see their knowledge base. It's genuine. I have met people I know. Fake is your repertoire. That's not what happened there. If anyone's coming out not rosy, you debunk that and give the truth to see it in real time. It's remarkable. Well, somebody analytical must be good enough to know what true talent and authenticity looks like. Not a lot of people do. A lot of people go to work and they finish and they're there for the paycheck. But that's not what I've seen. You guys have helped and given advice about things related to our son get diagnosed with autism since he was 2.5. And they share it now. I didn't know it existed. My baby just not been 14, but their kiddos are like 17 or 20 or 21. To see it's a true community of health providers that care.
I'm glad that it translates that way. I've played at least some of a role in creating an environment where those conversations can happen.
As an Army soldier, we come in contact constantly with people who need coming over there because they want something from you. Or this is the mission, everyone does their part, and then you move forward. That's not what I get in a medical. With you, it's always above and beyond. I don't know how many times I can write it, even when I'm trying to put in notes to say what I feel. Sometimes I don't send it right because she ever tell me I didn't do it. That's me. I'm working with y'all. I like to celebrate and give credit where due. And what I have seen is they are genuine. And
You're giving so many compliments to them.
the fun is I've seen a lot. We've been through a lot with our youngest, and he's been in and out of the hospital at Children's Health. Now, he has a team of specialists. A lot of them are from about everybody. At the end of the day, everything with a grain of salt. But when I say, hey, this is what's happening with my kiddo, and then you're making it to another baby, you say, hey, is it okay? And she's old. Guess what? You could do this, this, and this. Then they text me to do the thing that would help. About everyone I came in contact with is like, Dr. They're about their business. I'm gonna get back to the questions, y'all. I just wanted to share that. I needed you to understand why she's on this call. It's more than what she does. Okay. Question 4. How do time constraints and administrative tasks affect your ability to provide the best care? And what kind of support would make a difference in overcoming these barriers? This was a good one.
I know. I got 40 scheduled hours a week of patient care. My job's more than patient care. We're required to keep up with documentation, communication with patients, providers outside of that scheduled treatment time, marketing, relationship building, continuing education to keep our life is up to date. And I'm looking at my clinic, an amazing test who takes care of the brunt of the admin things like copay, scheduling, rescheduling, insurance authorizations, and that makes an absolute world of a difference for me and for the patient. In regard to documentation, so we write a daily note for each patient we see, and sometimes we do have 2 to 3 patients at a time that we're working with an hour. We want to focus on the patient, not on documentation, better quality of care. But with 2 to 3 patients an hour, you can end up with 15 or more open notes at the end of your day, and then you're documenting on your own time instead of heading home. There's a balance between documentation and patient care, but it's a skill that you learn over time. Like PG school, or at least I didn't, do notes in patient care gracefully. Not my experience. We're glad. Back to the student PT or the new grad PT, I think giving graduates the tools and the space and time to learn that skill would make a huge difference in their ability quality care. I think strategically scheduling patients where we're offering one-on-one care as much as we can, while also getting ourselves home at the end of the day instead of chronically saying right to the documentation done. Documentation's a booger. Well, sure, unavoidable.
Because you got to have a record. In the Army, we have a phrase that's if it's not in writing, it didn't happen. By turning around, I have seen you consistently work 2 to 3 people at a time, and you still feel like one person. I've no idea to do it. I've never seen it. What you were just able to do with all of us here at the same time.
Serious multitasking. It's a skill that you learn over time.
For sure. But to see it in action, it is a beautiful thing. Like a flow and fluid of music and water playing together to see it happen. And then see you even in between. Because like maybe if there was a way that, and this is what I've seen in Austin before I transferred, before we retired and came to this way in the country, there would be a person that would record the notes, the medical notes, while the individual was doing their actual work as a doctor with your patient. And there's someone else assigned to do the actual notes. But then there's programming now. I don't know if you ever heard of Naturally Speaking Dragon. It was an ADA accommodation for me that I had in college and my government job. Because I have nerve damage in my hands that added with my fibromyalgia. I would speak and it would dictate my notes. Sometimes I saw 6 people a day and I would be trying to fit them in that hour window, like you're saying. But they required a 7 to 10 page narrative for each person. the dictation for my dragon was great. So I don't know if they can incorporate how the dragon works in a health care thing where maybe it would be more of an app where it would really appear. And you can just say what you're saying, and then it compiles it into notes after you've trained it. So instead of you having to day at the end of the day to write notes, it's written while you were doing what you were doing already. Two things got done at once. I wonder if there's something out there like that. It'll be great.
If you can make it work.
I'll look up how the dragon is being. I don't know if it's used in healthcare in the government section where we were in healthcare. We had a dragon. Anyone who had disabilities, we had accommodations, and the dragon was provided. What resources or training do you currently feel is lacking in your field of PT where it would help your professional growth in patient care? What you do is about you and patient care. So
I struggle with this question because I get emails or every day about continuing education for everything. I could get online to take a course to get a specialization in cardiac rehab, geriatrics or pediatrics. The continuing education aspect of PT, when it comes to learning a new meal technique or the best new thing to do for the ACL patient for post-op rehab, is out there, and it's always going to be. What I don't see a lot of is how to manage burnout in PT. If any PT or healthcare provider is feeling burnt out, they're not going to sign up for a burnout with all of the things that they have going on. That's tough. I don't have a simple solution, but I do know things can't change unless you start talking about them. And what you're doing is talking about it. So I feel like that's a step in the right direction.
none of us know what we don't know, right?
Right.
Yep. And so that's what I was saying earlier. Like, yes, I did work 10 to 12 hour days all those years. And all my focus was how do I be there for my client? How do I be there for my patient? How do I be there for my veteran? They were there in the clinic and I was seeing them. It never dawned on me that burnout was going to creep in. And it may cost me my life. It almost did. And so to know at 36 that you're congestive heart failure, and then, it doubles back, because you keep pushing. You don't give up. As soon as doc says you cleared, you go back to work and you're in the grind of them. Because as healthcare professionals, what do? We're givers. We're givers. We'll give everything of ourselves to take care first. All the time. We do it every day. That's why we're there working side by side, staying to get the notes done, because you care. And when you do that and you don't, like we said way back at like the first or second question, to pour into the new students when they come out, healthy boundaries, to know what that looks like and still be able to, you know what? There's going to be more for you to do tomorrow. Right now, I need to take care of you. Love you. Let's go. You're right. A lot of times when people hear the word burnout, I'm not going to tell anybody what I'm feeling, because then everybody will know. Mental health, it is being addressed more, I think. You see a lot of people making it more popular to discuss. In reality, that everyone's rich. Not on a scale big enough for us to see max level stuff. I'm talking about right here in this little world that we're in. Can we just be honest? When you do that, everyone can adjust. One of my mentors said, stop thinking you have to give people what they need up front, because they don't actually hear the need. What's about burnout? You have to give them what they want. Dress it up and give them the pretty pack. When I say resilience and renewal, that sounds pretty. But what I'm really saying is, burden is real. I need you to stop playing. Hear you. So you're not where I was in 2017. Because I don't want to see another professional have to give up and make a choice between their career and their life. It's fair. The colleagues that I saw, like literally colleagues doing the same job as me, that I saw get put in casket, that's an awful feeling. Because you saw them working those 10, 12-hour days. It was like, what can I do different? That was the only thing in my head when I was attending the funeral. It's like, what can I do different? I can change how people receive that. We can still care. You can still be a devoted Dr. Ruff in physical therapy. You can still share and change lives, make people better. Well, they can raise their arms when before they couldn't go home exhausted where you don't have energy left to do anything for you.
Right.
That's all I'm saying. I just haven't figured out how to do that enough where people get it. I share my tools and books. I've written 3 or 4 books. And someone will say, come in and I'll give them the tool. And you say, I think that business sense. What do you mean? You don't do that. If we share from our souls, more people will understand the value of getting themselves right and in alignment so they can harmonize with their beliefs, careers, their health doesn't have to suffer, and they can still do a great job in their careers. It's like, wait, is that too much to ask? You want Prince. We were just thinking it is. We're getting there. Now, I think we only have, in terms of work-life balance, remember I said, most people say balance, but in reality, I say harmony, because harmony comes from within. You pay the cost to be the boss of you. Work-life harmony. You can say balance and let you chill better. What specific struggles do you experience? How could workplace culture or systems be improved to support your well-being?
Workplace culture for me right now is awesome. I'm very lucky. I love the clinic and the people I work with, which I think you talked about earlier. It shows through your patient care. If you're comfortable in having a little time. I used to bring home notes every day about cases that I would have on Monday throughout the weekend. I would take on the emotions of my patients. I would work through sickness, afraid to leave my patients with other therapists, losing control over their care. I knew I could do a good job, which I can't take care of a person who's hurting in front of me. I can't place a lot of blame on a company or a clinic that starts with me. There's multiple situations in which I could have set better boundaries. I could have valued my health mentally and physically as much as I value my patients. I'm glad it's something I've been able to work through because it's a learning experience. And now I know, and now I'm better for it.
And full knowing is half the battle. Okay. Once you know, you're supposed to do better. And now you do. I love that answer because we all do that. Or at least we should. Not saying we always do, because that's why my company is called Implemented Knowledge Institute. How many of us, like myself included, can attest to how many of us know that we've heard knowledge is power? Like, have you heard that phrase, knowledge is power? Right. But then in reality, you heard knowledge is power, but how many times you didn't implement the thing that you knew you were supposed to do? You still knew the information, so knowledge is not power. Implement it, knowledge is power.
Right.
You don't even do anything with knowledge. It didn't help you. So I disagree. When people say knowledge is powerful, I was like, I think y'all must think that phrase sounds cute. That's why I didn't say it. Do it 3 days, man. 2 more days, not do it. And then pick it back up. Well, enough where it becomes consistent, and then it doesn't make a difference. You know, 5 o'clock come, you should already be in your car. You could know the right thing and still choose not to. How do you handle the emotional toll of working with long-term or chronic care patients? And what strategies would be helpful in helping them manage the emotional aspects of care, as well as for you? Because when you're looking at them, you worry. So
I'm an open book. I go to counseling once a week. I find help through counseling. I make sure I'm processing things. There's an app called Headspace. My company pays for all its employees, and it has guided meditations. It has breathing exercises. Another thing that has helped is setting healthy boundaries between work and home. I do better on nights and weekends, stay extra minutes at the end of the day, get notes done at work, shut my laptop, and go home without it. I have a rule. I don't listen to anything on the way home. I won't call anyone. I don't do podcasts. I don't do music. Not that I don't love doing those things, but it's important for me to process things before I walk in the door. Something crazy happened at 7 a.m., then another at 10. Your brain is pulled in a different direction. You forget about whatever happened in the morning, but not in the front of your mind, but still in the back. Give yourself time to process on the way home so it doesn't show up later.
Yeah, it's like they call it displacement. You know what that looks like. So you don't even risk it happening to you where you would displace on anyone that you care about and love at home. You decompress in your own way, in your zone, on your way home. So when you open and put your key in the door, you are refreshed to go in. You've taken off that work experience. You're done with it. That's beautiful because not everyone's beautiful. In the military, that's something we run into a lot. It comes home with you. Like if it's in the bedroom and you're trying to figure out what to do with everything. I like that suggestion.
It feels weird at first. I used to call my boyfriend after work every day when I was just starting off. Over time, I started to realize it was just like word vomit on my end, what my day was like. And we have different jobs. He's an engineer. My day is a little crazy compared to his. I would just kind of word vomit all over him. And he'd be like, yeah, today was the same as yesterday. It's not fair to him to word vomit else instead of taking the time to work through it on your own.
There's a control and power when you do it that way. Like you said, work through it on your own. You are powered when it comes at you. You're prepared now. You're a superhero. You got this. It's a completely different thing when you have realized, oh, wait a minute, I am in control. Energy is everywhere. Those moments back in the day when you were word vomiting, could you tell the difference in your energy? Did your energy feel good or bad?
You know, it felt bad for a while. And it wasn't just when I was word vomiting or staying late. It was a complete lifestyle change. It bleeds into everything. It doesn't just affect one thing and not the next. It's a lifestyle.
It bleeds over. And that's what I mean when I say energy is everything. Because when you have enough negative energy, it will begin to affect you physically. And that's why I know what you do as physical therapists is powerful. There is a connection between mental and physical. You can think and feel yourself into an ailment because you continue to be in that negative place of energy. So then when something shows up on a scan or shows up in your blood work, what do you think it can grow? You live in that negative place anytime you want to. You could have drove home in silence.
It sounds fun, right? Driving home in silence.
But it sounds, I mean, I think it sounds good. And I know it feels good because I do meditation. The days that I am consistent, if everything about my day is the days that I missed because I woke up late. The baby was up to 3 and he didn't get any rest. And by the time I got him settled and his meds done and hooked up his feeding tube, I'm exhausted. So I just start my day. It feels chaotic. I'm missing something because I didn't get that hour. So you didn't realize how powerful it was and how it fed your soul. So I love that your company has space for you to log in. It's not that. I have been mind blown with this conversation tonight because I knew you were going to be powerful. I just didn't know how good it was going to feel because I hadn't planned for that. I knew my knowledge of machines, this is going to be good, but not how good it was going to make me feel. And this is how I know that I'm in the right place. If I can make sure that we're getting in front of the real deal and putting things in place, like tangible things healthcare workers can do now to combat burnout, compassion fatigue, emotional stress. Now they have something in corporate world called change fatigue. Since COVID, companies had to adjust. Employees got put in topsy-turvy. Change fatigue is just as bad as emotional distress and compassion fatigue in healthcare. If I get them to understand what I do is unique when I'm helping people, I'll have them do something as simple as the 3-legged race is not just a 3-legged race. They have to do something that shows them what burnout looks like and then learn and implement the solution and strategies during the process of what they're doing as the team during the 3-legged race. And so people are like, I don't see how that's, don't think of it crazy first. Start practicing what you see in the lesson. When you see it begin to work and feel better, you come back and tell me I'm crazy. At least do it until you can prove me wrong. I love the fact that where my mind works always is, where's the solution? Like, in fact, it's solution focused. I know there's a problem. If we focused on the solution, we don't fix it the same way for each person. I just need the person to be all in when they say they want help. That's what I see you do. I see you every day when you're at therapy, when I'm there, and then hearing when I'm talking to someone else and they're talking about their experience. That's what's great about the consistency. You're an open book. You're the same no matter what patient you're with. And that's lovely to see. A doctor that genuinely cares about you. If it's Dr. Ruff. I call her Dr. Ruff because it's her name. Thank you for being on this podcast, because this weekly well-being tip is going to reward lots of folks who listen, for them to understand that in healthcare, there are so many things where we can accomplish when we do it from our souls and our hearts, or we want to make a difference, but then do it safely. As healthcare professionals, I am grateful for you going here. So, yeah, it's a little.
You opinion enough to have me on. That's awesome. And I'm just really glad to hear that you had a positive experience, that you feel like the people around you are having a positive experience. Because at the end of the day, that what a comfortable environment, getting people moving. And it's about conversations like these that we're able to have. See, visualist, we get to build. It's awesome. I'm thankful you had me on.
I appreciate it. Well, there you go. Enjoy your evening. Tell your outstanding engineer, thank you. My handle is Mrs.P. When you see Dr. Ruff or let her go, remember you seeing his podcast. There's this beautiful blonde person there, this doctor that literally cares truly about you, wants to make a difference for you today. Don't come in there being the faint of heart. It's not going to let you get away with that. You're going to come in there really ready to work and get your help in order. This is the end of our weekly well-being tips from Mrs.P. You heard it from Dr. Ruff. We love it. You guys are listening. Take care. We send you much love, success, and support. Have an amazing day at work tomorrow. Thank you again.
What do you got? Peace now.
Yeah. Mayo.